Hello, everyone. My name is Carol Williamson Williams, registered nurse midwife attached to the General Hospital, Grenada. I am going to present to you rabies, a global health issue. Here we can speak a little bit of the history of rabies. Rabies can be dated way back to 300 BC, as mention was made of it in several ancient literature. It was also mentioned in one of the early papers by Aristotle. Human rabies is present in 150 countries and territories and on all continents except for Antarctica. Globally, estimates indicate that human mortality as a result of canine-mediated rabies is highest in Asia, with India having the highest incidence of death reported. Africa closely follows Asia with the second highest human mortality rate. We're going to define rabies. Rabies is a zoonotic disease that is caused by a virus. The disease infects domestic and wild animals, especially the mongoose, and is spread by people through close contact with infected saliva via open wounds, such as bites or scratches. It affects the central nervous system in humans. The etiology of rabies. The agent causing this infection is a rabidovirus, which is present in the saliva and central nervous system of rabid animals. Here is a drawing, here is a photograph of what the virus looks like. Mode of transmission for rabies. People are usually infected following a deep bite or scratch by an infected animal. Dogs are the main host and transmitter of rabies. Bats, mongooses, and dogs are some examples of animals which transmit rabies. Transmission can also occur when infectious material, usually saliva, comes into direct contact with human mucosa or fresh skin wounds. Human-to-human transmission by bite is also theoretically possible but has never been confirmed. Rabies clinical manifestations. The incubation period for rabies is typically 1 to 3 months, but may vary from 1 week or less than 1 week to 1 year. The initial symptoms of rabies are fever and often pain or an unusual or unexplained tingling, prickling, or burning sensation at the site of the wound. As the virus spreads through the central nervous system, progressive fatal inflammation of the brain and spinal cord develops. Strategies applied to address rabies, a global health issue. Rabies is 100% preventable. We can look at vaccination, the post-exposure part of it, where we have 1 dose of rabies immunoglobulin, and it's given according to weight. It's a course of 5 doses of rabies vaccine over 28 days. The first dose is given on day 0, the second one on day 3, day 7, day 14, and finally day 28. They can be taken in an injectable form. Vaccination of animals, including livestock and pets, is advised. Public awareness campaigns on vaccination and responsible ownership and animal welfare is also another important aspect in terms of managing rabies. Funding agencies can come together to put mechanisms in place such as vaccine banks, reporting systems, and control tools to aid in the process of eradication of rabies or any illnesses or death associated with this condition. We're speaking about rabies, and here we're going to speak about an analysis of the global health issue. Every year, more than 15 million people worldwide receive a post-bite vaccination. This is estimated to prevent thousands of rabies deaths annually. 40% of people who are bitten by suspect rabid animals are children, usually under the age 15. Dogs are the source of the vast majority of human rabies death, contributing up to 99% of all rabies transmissions to humans. Canine rabies cost the world $124 billion annually, but could be eliminated by vaccination for as little as $6 billion. Developing countries suffers adversely from rabies-related illnesses and death in comparison to developed countries. Each year, rabies impacts the lives of many as 5 billion people. Over 95% of human rabies deaths today occur in Africa and Asia as a result of being bitten by an infected dog. Here we can address some of the suggested solutions for curbing rabies. First of all, we can engage in massive public awareness programs on the importance of having pets vaccinated. Also, developed countries can help developing countries to access funding agencies to assist with aiding with the cost of procuring vaccines. Agencies such as World Health Organization and Global Alliance for Rabies Control, along with their governments, can assist in developing countries in developing a strategic plan to eradicate illnesses and deaths associated with rabies. This presentation, we've been speaking about rabies, and here I am making a reference to rabies locally. In Grenada, in 2011, we had 18 cases. 2012, there were 12 cases. 2013, 20 cases. 2014, 10. And 2015, 6. Adjacent to this graph, I've got here another photo which reflects rabies globally. It says rabies in countries are the areas at risk. So this area we can use it as a comparative chart so that we can see what's happening in Grenada compared to the rest of the world. I want to say thank you for taking time off to listen to the information presented on rabies. At least I hope I have given you some bit of information or shed some light in terms of rabies as it relates to a global disease as well as a zoonotic disease. Thank you.